we had two posters in the poster session. Both posters were about our CALLIPER trial. There's a phase 2 trial in progressive MS that we read out middle of last year, and we presented some additional data on EBV reactivations and also MRI outcomes in this trial.
Hello, you're watching Proactive. I'm joined by Immunic Chief Medical Officer, Dr. Andreas Müller. Andreas, very good to speak with you. You've just returned from the ACTRIMS Forum in San Diego, a conference focused on multiple sclerosis research and treatment. Immunic presented new data from the CALLIPER phase 2 trial there. Can you walk us through the key takeaways, please?
Yes, hi Stephen, and great to talk to you again. Yes, I just came back from the ACTRIMS Forum meeting in San Diego, and this is a North America-based meeting with both experts from the neuroscience community and clinical neurologists. So you really look at the research, the new research in MS, but also the clinical application and clinical trial. So it's a nice meeting to get a broad overview. We were there with a very good team. We had several members of the management team there. We also had members of the medical and biomarker team there. We had a booth there in the industry exhibition, and so we were well represented there, to my mind. We had two posters in the poster session. Both posters were about our CALLIPER trial. There's a phase 2 trial in progressive MS that we read out middle of last year, and we presented some additional data on EBV reactivations and also MRI outcomes in this trial.
So, as you mentioned, Andreas, one of the posters focused on MRI outcomes from the CALLIPER trial and findings for acute and chronic inflammatory disease activity. Could you tell us more about that, please?
Yeah, I'm happy to. So, as we know, MS are now basically two diseases that are overlaid of each other. It's a acute inflammatory disease that's mainly driven by the peripheral immune cells going into the brain and causing lesions, what we call MS lesions, that we usually detect with MRI. And in MRI, we usually consider them either gadolinium enhancing lesions or what's called T2 lesions. And it's just different ways of detecting different stages of these lesions that are caused by acute inflammation. In this poster that we've shown is that we had a reducing effect on both these gadolinium enhancing lesions and also the T2 lesion load, or the number of T2 lesions. So I think that's more or less that vidofludimus calcium has an effect on this first component of the MS disease. The other component of the MS disease is a little bit different because it's still inflammation, but it's an inflammation inside the brain. We don't fully understand it yet, what really drives it, but it's characterized by what we call chronic compartmentalized inflammation. And in principle, it means this is something that's happening in the brain. It's not fast. It's just it's a chronic inflammation, and our normal MRI measure that we had, like these MRI lesions, don't really work. So what we learned is that we can get a biomarker picture in MRI about this chronic compartmentalized inflammation with something that's called SELs, or slowly expanding lesions. These are lesions that actually very slowly over time expand, sometimes with a rim around it that's very characteristic. And I think the good news is that in the CALLIPER trial, we found a statistically significant reduction of these slowly expanding lesions as compared to placebo for the 45 milligrams of vidofludimus calcium. So I think it was a very nice way of showing that vidofludimus calcium has an effect on both the acute inflammation and also this chronic compartmentalized inflammation.
Andreas, you mentioned that second poster examining the effects of vidofludimus calcium on EBV-specific T-cell receptor repertoires. Why was it important to explore this aspect, and what does it add to the understanding of how vidofludimus calcium may work in progressive MS?
Yes, I think since about 3 years ago, the publication came out that clearly showed now that EBV, so Epstein-Barr virus, is a necessary condition for MS. So that's basically saying we're almost sure it's the cause, but we call it now a necessary condition for MS. And EBV um, is a chronic viral infection. So it's more or less you get infected relatively early in your life, usually. Almost everybody is infected with EBV at some point in their life. And it's a sleeper virus. It basically resides in immune cells, mainly B cells, and survives. And you only hold your immune system only holds it in check. The interesting thing in MS that we learn more and more over the last years, and there was a very recent publication about this as well, that there seemed to be what's called molecular mimicry. So our immune system reacts to the EBV antigens, for example, but the antibody that our immune system produces are actually also by chance targeting structures in the central nervous system. So there is now the increasing possibility, or there's now a hypothesis that um, this constant EBV reactivations that happen, the sleeper virus wakes up once in a while, um, also contributes to a progression of the MS disease. So not only that it's maybe causing or it contributes to causing the MS, but also that it contributes to the disease progression over time. And the reactivations are of great interest and of great importance if that hypothesis would be true. So vidofludimus calcium is an antiviral drug, a broad spectrum antiviral drug. We had preclinical information that it actually reduces the number of EBV reactivations. And this from the CALLIPER trial, these data from the CALLIPER trial really show for the first time that there's also a clinical evidence. There's clinical evidence that vidofludimus calcium is causing a statistically significant reduction in EBV reactivations with treatment over time as compared to placebo. The method is a little bit, I think, not as easy to explain. This is called T-cell repertoire. In the music industry, you would say you measure like the top 100 of songs that are currently playing in the radio stations. Here, T-cell repertoire basically measures what are the most common antigens that the T cells experience, and you can measure this with this T-cell repertoire, and you see then that in the vidofludimus calcium treatment that basically the EBV antigens drop basically from the first places and go down in their popularity, let's say. Yeah, so I think it's a measure of saying that you have a lower number of reactivations that the T cells see. So that was very interesting data. It's an emerging field in MS to really understand more and more the contribution that the EBV reactivations do in the progression of the disease. But at this point, I think we're happy that we were able to show this in a clinical trial setting.
Andreas, looking ahead to 2026, how do you see this year shaping up for Immunic overall, and why could it be a particularly important period for the company?
Yes, so I think as we always say in the company here, 2026 is the year of Immunic. And the reason is really any biotech company that had develops a drug over many years, over a decade, and then is able to go into phase 3. And now we're really reaching the period where we will have the readout of our phase 3 trial at the end of 2026. So we will report on both of our phase 3 trial in relapsing MS at the end of this year. This is a large program for any company, but also especially for a biotech company, because each of these trials is at least 1,100 patients. So we have 2 trials that are identical that we will read out. We have executed a large program. We come to the place now where we can see the results of the phase 3 and really think about basically regulatory approval submissions and potentially launching this product at some point in the near future. So that's a very exciting area, and that's why 2026 is a great year for us, and we're very much looking forward to seeing the data finally that we're very hard working on for a long, long period of time.
I'm sure you'll be having lots of interesting discussions as the year progresses. Thank you very much for your time today.
Thank you, Stephen. Happy to be here.
Dr. Andreas Müller, he's the Chief Medical Officer at Immunic.